السلام عليكم ورحمة الله وبركاته. بسم الله والصلاة والسلام على أشرف الأنبياء والمرسلين محمد وعلى آله وصحبه أجمعين. Good evening everyone. Again, I hope you and your family are doing well. في البداية أسأل الله أن يتقبل منا ومنكم الصيام وقيام صالح الأعمال. So allow me to introduce myself again. I'm Nada Sfayan, a senior dental hygienist who having a Master of Science in Dental Materials from University of Sheffield. I'm a lecturer at King Saud University Dental Hygiene Program. I'm a board member at SDHS and an active member at CME committee at SDHS. So it's my great pleasure again to welcome you to the third and last but not the least scientific webinar under the theme SDHS statement on COVID-19 pandemic. It's accredited by the Saudi Commission for Health Specialists and planned and organized by the Saudi Dental Hygiene Society. So I would like to remind you that we are planning for more scientific lectures, inshallah, and webinars to be presented very soon for our dental hygiene community and other dental healthcare colleagues. So before introducing today's topic, I would like to pay your attention to some points again. The first thing, neither speaker nor the organizer had no relationship or commercial interest with any entities. The CME hours will be provided for only SDHS active members of 2 CME hours per lecture. If you are facing any technical issues while registering to SDHS membership, please email the sdhs.tech.sub@gmail.com. If you have already registered with us and you need to see your SDHS membership ID, you can check this by signing into SDHS website and you will find all of your details. In order to get your CME hours, you have to fill the required information and the feedback survey after the session immediately. You will find the link in the chat board at the end of the webinar, or you will be directed to the link automatically when you leave the session. If you have any kind of question, please type in your question in Q&A box. So now coming back to today's topic. As you know, the world is taking a global battering because of COVID-19. So through this webinar, inshallah, we will learn how we can be immersed better and how to be professionally stronger and how can we make our best in lockdown time. So our prominent speaker today, he is a focused academician in the oral health who works to alleviate the burden of oral diseases in Kingdom of Saudi Arabia, mainly at a community level. He is a professional with master's degree in dental public health from University of Sheffield in UK, including diploma of membership from the Royal College of Surgeons in England. At Sheffield, he was awarded with the University of Sheffield Graduate Award and also Enterprise Skill Build Award. He was also awarded with the Fellowship of Royal Society of Public Health at London. Currently, he is assistant professor at Qassim University at Department of Dental Hygiene. Now let's give a big welcome to Dr. Mushir Mulla. Dr. Mushir, the mic is yours now. Dr. Mushir, are you there?
Hello. Can you hear me?
Can you raise your voice a little bit?
Hello.
Yes, much better. Hello.
Bismillahir Rahmanir Rahim. Alhamdulillahi Rabbil Alameen. Wassalatu wassalamu ala ashrafil anbiya'i wal mursaleen wa ala alihi wa sahbihi ajma'in ila yawmiddin. I welcome you all with the best of the greetings, that is the Islamic greeting. Assalamu alaikum wa rahmatullahi wa barakatuhu. First, I would like to thank Saudi Dental Hygiene Society for giving me this opportunity to speak up on the topic Scale Up During Lockdown. Because of the time constraint, I would like to immediately move on to the topic. Could you please share the screen? We'll start with our presentation.
You can share from your side, Dr. Mushir.
So by the end of today's session, we are going to see what are the activities to be done during lockdown, how to maximize the outcome, how to facilitate professional development, and in the end, how to be a winner. As you all know that the world is taking a global battering now because of COVID-19. Mankind is now facing a global crisis, and this is perhaps the biggest crisis of our generation. Last time the world had seen a similar crisis was in 1918. It was almost 100 years back, by the name called as Spanish flu. So today, what are we going to see in today's session? After the session will be over, inshallah, you will be able to answer that how can we emerge better and professionally stronger? How can we make the most of this time during lockdown? What next in terms of professional development? What kind of a person we will be once the storm of COVID-19 passes? So the first thing I would like all of you to do about yourself is a SWOT analysis. What is SWOT analysis? It is analyzing yourself and writing down one's strengths, weaknesses, opportunities, and threats. I think you all are aware about the SWOT analysis. So in SWOT analysis, what are we going to see? We are going to write down, we are going to analyze ourselves, and we are going to write down our strengths first. What are the strengths? The strengths are factors which are likely to have a positive effect on us. It can be anything. It can be your good communication skill. It can be your good clinical skill. So these are your strengths. You have to write down. Whatever your strengths are there, you need to analyze them and you have to write down. Second thing, we'll move on to the weakness. Again, it is an internal factor which has got a negative effect on ourselves. You have to write down what are your weaknesses. You have to jot them down and you have to work on that. Weakness can be, again, anything. It can be your low confidence level. It can be your poor communication skills. It can be your poor clinical skills also. So we have to jot down the weaknesses also. And these weaknesses are the things on which we are going to work on the more. Then we'll move on to the opportunities. We are going to see what opportunities lies in front of us, especially at this moment, at this time of COVID-19. You have to see, like, for example, webinar is one of the opportunity for you. There might be some other courses, online courses, that again is an opportunity for you. So this is an external factor. So opportunities also, you can look for some scholarships which are available for you if you want to pursue some kind of masters. What are the conferences available, some kind of courses you can join. All these are the opportunities with which you can benefit. Then we move on to the threats. What are the threats? These are the factors, again, which can have a negative effect on you. So a threat can be a financial constraint. You can be financially not so well off. It can be a geographic constraint, something you want to attend, but because of this COVID-19, you are not able to attend something you might have planned before, that you want to attend some kind of conference or some symposium or some workshop, but because of this COVID-19, you're not able to attend that. So that is because of geographic constraint that has become a threat now. High competition. If you want to pursue masters or if you want to do something, there is a high competition and you're not able to do that. So that is again a threat. So out of these strengths, weaknesses, opportunities, and threats, you are going to work on the weaknesses and the threats, okay? And you are going to improve further on your strengths and opportunities. I hope it's clear. The strengths and the weaknesses are the internal factors the factors which are found to be in a person. The opportunities and the threats are the external factors which are not found in the person. Again, I repeat, the strengths, like they are the factors which has got a positive effect on a person. Like, for example, a person can be having a very good communication skill or a clinical skill. Okay. But the weakness, again, the person maybe he's not having a good communication skill, or he's lacking in some other soft skill like time management, negotiation skills, okay, clinical skills, research skills. These are the weaknesses. So the first and the foremost thing what one must do at this time is to start analyzing yourself and write down your SWOT analysis. Opportunities are the external factors. Okay. Again, the opportunities have got a positive effect, and the threats are the external factors which has got the negative effects. I hope this SWOT analysis is clear. Now, especially, I would recommend you to focus on these skills during this lockdown. And you must work on these skills. If you're good at them, fine. If you're not good at them, start working on them. Okay. The first thing what we are going to see today is communication skills. Then we'll move on to infection control skills in dental settings, which is very important, especially after COVID-19. We have realized the importance of infection control. Then detailed history taking skills, again an important thing. Clinical skills, as a clinician, it's important for us to have a clinical skills and research skills. So the first skill what we are going to move on to is communication skills. For communication skills, in one of the studies by Oxford, the first thing patient looks in a dental hygienist or a dentist is a good oral communication. You need to really have a good oral communication to build a rapport with the patient. If you don't have a good oral communication, you will not be able to build a good rapport with the patient. Okay. It's called as, it supports the adage, the first impression is the best impression. So if you're really good in your presentation or in your communication skills, it has a good impression on the patient. So how are you going to improve your communication skills? If you're good at communication skills, well, fine. But if you're not good at it, there are many things which are available on the internet with which you can improve your communication skills. Like there are videos, there are webinars you can enroll for, there are podcasts you can listen to, there are courses on communication skills or on soft skills also. And by reading books also, you can improve your communication skills. I would recommend there are many free videos on patient communication on the internet. You can go and enroll for them. You can watch them. You can enroll for the webinars and the courses. One course here, which I would like to highly recommend you, is on improving communication skills by University of Pennsylvania, UPenn. UPenn is an Ivy League university, you might be aware. So they have got a free course on improving communication skills. Okay, if you're really interested, you can enroll for it. There is a slight catch in the end. Like you can enroll for the course for free, but at the end you have to pay for the certificate, and the payment is not much. I think so it's around $50 or $100, but it's worth it. If you get a certificate after completion of the course from University of Pennsylvania, it's worth it to spend $50 or $100. Then we'll move on to infection control skills in dental settings. Infection control skill is a very important skill, but which I feel it was somewhat ignored by dental and dental hygiene professionals. Recently, it has been highlighted and we have given more emphasis because of COVID-19. So we must be up to date with the infection control skills in dental settings. Okay. One must read the material available by CDC, Center for Disease Control and Prevention, by WHO. And then there is a very good manual of infection prevention and control in dental setting by Ministry of Health in Saudi Arabia. So one must really, I feel, one must really go and read this manual on infection control. There are many videos on infection control skills. There are many webinars. Upcoming webinars are also there. I have highlighted some of them in my next slide. I'll show you. They're really good webinars. One must attend, I feel. And then there are courses also. I was talking about this COVID-19 and the dental practice webinar. It is by Viva Learning. And I think so it's the upcoming webinar. You can enroll for this webinar and it's for free. There is another webinar which is going to come, infection prevention in dental hygiene treatment room. What will post COVID-19 look like? This also is going to be a good webinar. If you're interested in improving your infection control skills, go and enroll for this webinar. Review of CDC infection control guidelines in dental setting. This is the third webinar which I have enlisted here. And the last one is the course over here by American Dental Association, Practical Infection Control in Oral Healthcare Settings. It has got a course fees of $276. So you take a call. If you feel you need to improve your infection control, go for it. It's a good course designed by American Dental Association. You can enroll for that. Moving on to our next skill, that is detailed history taking skill. Believe me, I have come across many good clinicians. Clinicians in terms of their clinical skills, they lack recording correct and detailed history taking. Okay, they are really good in clinical skills, but they lack detailed history taking. So one must be good enough in recording case histories. Okay, because one small mistake or missing out something important, it will land you in trouble. It will land any of the clinician in trouble if we miss a small important detail. There are some videos how to record a case history. There are webinars, upcoming webinars are also there. Archived, pre-recorded webinars are also there. Courses are also there, which I'll recommend you. Here, one course is there on Introduction to Dental Medicine by, again, University of Pennsylvania. This course is provided by Coursera. I would highly recommend you to join a free course on this. Okay, this you can join and you can improve your history taking skills. So if you really want to, they have got a session, and I think so it's a 4-week course. They have got some videos on physical examination, intraoral examination, extraoral examination. It's a beautiful course designed by University of Pennsylvania. You can enroll for that. Moving further to our clinical skills, as a dental hygienist, we all know that we must master some certain clinical skills. You will be called a good dental hygienist if you will have those good clinical skills. The most important clinical skill I feel is a periodontal instrumentation, which makes you apart from other profession, like a dentist or a periodontist also. I feel he also cannot do a good periodontal instrumentation what a dental hygienist can do. Okay, so you need to hone your skills of periodontal instrumentation, because that is the skill what you need to master as a dental hygienist. Other skill like teeth whitening, local anesthesia administration techniques, preventive treatments like sealant or fluoride application, fluoride varnish, fluoride gel, all these clinical skills I feel dental hygienists should master. And to master these skills, you again have got many videos available on the internet on local anesthesia administration or like periodontal instrumentation, teeth whitening. You'll find many videos. There are upcoming webinars. There are already pre-recorded webinars. Most of the webinars are free these days. There are courses available. There are literatures. You can read them and you can improve your clinical skills. Now there is one upcoming webinar on 15th of May, which I would like to highly recommend you. This webinar is by Anna Patterson, and it's going to be from 15th of May till 19th of May. It's a 5-day web series, but it's going to be worth it. Believe me, I have attended this webinar. Like I have attended one, like the periodontal instrumentation session by Anna Patterson, and it's worth it. It's amazing. Then there is going to be a webinar on elevating your instrumentation skills, the Dental Hygienist Unplugged by Viva Learning. You can enroll for the webinar. Here I've provided you the links to enroll for those webinars. Again, continuing the education classes, very often they are being conducted by UFready. I have given you the link for all the continuing education classes by UFready. You can enroll for them. You can subscribe to them, and you'll be getting the notifications for the webinars, for the upcoming webinars. Research skills. Research skills are important. You all are aware, especially if you're pursuing or planning to pursue master's or PhD. even in bachelor's, some of the programs, they have got capstone project where research skill is required. Most of the program, they have got research methodology as a compulsory subject. It is needed for a dental hygienist to to have a knowledge about research. So if you don't have a knowledge on research, you can improve your knowledge by reading books, literature. You can enroll for the webinars, you can attend some courses, you can enroll for free online courses are also there. You can attend symposiums, workshops, seminars on research methodology. Here, one very good course, a 4-week free online course is available by University of London. It's provided by Coursera. And the course name is Understanding Research Methods. I've provided you with the link. You can enroll for the course, and it's a 4 weeks course. It's a free course by University of London. There are many other courses. There is a masterclass webinar series by University of Alberta, Canada. They have got many courses. Those all are archived free webinars. You can choose from them. They have got a webinar only on qualitative research. Again, they have got a webinar on quantitative research. They have got a webinar on cross-sectional studies. They have got a webinar on like longitudinal studies. So whichever you want to opt for, you can opt for from these courses or from these web series provided by University of Alberta, Canada. There are many free courses offered during this lockdown by EDX, Coursera, online learning, harvard.edu, Viva Learning, etc. Okay. So in addition to the discussed skills, there are many free courses which are also offered by the top universities in the world. If you want to opt for the courses like personality development, somebody will feel that my weakness is I don't have a good personality. I need to develop my personality. So you have got a course on personality development. You have got a course on soft skills. Someone might be inclined towards public health, especially at this pandemic. One feel that I need to do something for the in public health. So there are courses on global public health. There are courses on epidemics, and they are by one of the top universities. There is one very good course on epidemics. It is in 3 parts: epidemics 1 and epidemics 2, and it is provided by University of Hong Kong. There is a course on global public health. I think so that is provided by University of Stanford. So all these are the top universities of the world. If you will browse them, you will come to know they are the Ivy League universities, they are the top universities, and they are providing all these free courses. But again, as I have told you, there is a slight glitch. What is it? At the end, if you want to have the certificate from those universities, you need to do the payment. But I think so that is worth. Like even if you will even if they're asking you to pay $100 for a certificate from University of Harvard, and you can enroll for a free course, that is fine. By the end of like 4 weeks or 6 weeks, you will be done with your course and you will be having your certificate. You can also work on getting admissions on master's degree. This lockdown, this period, you can utilize wisely, you can utilize productively, and you can work for the bachelors. If you really want to pursue masters, which I feel everyone must, you have got a good time for you to introspect. You have got a good time to do research. You can do master's degree. You can have a master's in dental hygiene from the universities like University College London. These are my suggestions. I'm not recommending them. For master's program, I would like to add one thing. Like if you're really planning to pursue a master's program, you have to look at that particular university's master program, the curriculum, like everything. You have to look at it. Okay. After that, you need to discuss that the curriculum with the colleagues, with your seniors, with your teachers. And if you feel that you fulfill the eligibility criteria, that master's degree is the one what you are looking for, you can go ahead with that master's program. There is a master's in dental hygiene program, as I was telling, provided by University College London, University of Texas, San Antonio. Washington University has got a good program. Alberta in Canada also has got a master's program in dental hygiene. Here, I would also like to add one more thing. Other than this MSc program in dental hygiene, dental hygienist can opt for other master's program also. Like you can opt for master's program in public health, master's program in dental public health also. You can opt for master's program in dental materials. You can opt for master's program in forensic dentistry. These are there is a master's program in infection control also. Recently, I think so. When I was browsing, University of Dundee has got a good master's program in infection control. So if you need to work out on that, and if you want to pursue masters, you need to find out your liking, and accordingly you can enroll for these master's program. These are some of the master's program I have enlisted over here. You can go on their websites and find personally you can find out about them. Then you can also work on the fellowship or membership from renowned world bodies like American Academy of Dental Hygiene, Royal Society of Public Health. You can become a member, you can become a fellow of these societies or these academies. Okay, there are certain benefits. Definitely there are benefits of joining these academies or joining these societies. I remember recently one of my students, he asked me, doctor, what are the benefits of joining any society, or why should I be an association of my specialty? He's a dental hygienist. He was asking me about like Saudi Dental Hygiene Society. I told him that there are many benefits for the members, there are many benefits for the fellows. Like say for example, for today, after the webinar, for the ones who are Saudi Dental Hygiene Society members, they will be getting the certificates or they'll be getting the CME points. But for the ones who are not the member of Saudi Dental Hygiene Society, they will not be able to get those points. So there are definitely lots of benefits attached. Lots of benefits are there if you are attached with these academies and these societies. What are the other activities you can do? What are the other activities you can explore during this lockdown? Okay. So the first thing what you can do is you can subscribe to a good journal. Look for a journal like Journal of Dental Hygiene, International Journal of Dental Hygiene. They are good journals. You can subscribe them. You know what a good journal can do. Go for a good journal. Look for the cases. That's how you're going to improve your skills. Okay. Explore good international masters or PhD programs. This I have told you in the previous slide. If you're planning to pursue masters, you need to explore good international masters program, PhD programs. First, what I would recommend you is you have to do masters in what specialty. It is again not necessarily for a dental hygienist to pursue masters in dental hygiene. You can pursue masters in other specialties, as I have told you. So you have to explore good masters, and the ones who are already masters, you can also explore for good PhD programs. PhD programs have also come up. Sometimes they come along with fellowships, they come along with scholarships. So explore them. If you get good PhD programs with scholarships, nothing like it. Sometimes they even give you a stipend. Your fees are waived, you get a studentship, your fees are waived, and you get a stipend also. So you need to explore those good international masters or PhD programs. Believe me, this is a very good time for you to explore all these things. Maybe after this, inshallah, this crisis gets over, maybe you will not have that much time to explore all these things. So if you have got this time, use it wisely. You be a member of a dental hygiene association. As I have told you, be a member of Saudi Dental Hygiene Society, be a member of American Academy of Dental Hygiene. There are certain eligibility criteria. I'm not fully aware about those eligibility criteria, how to be a member of American Academy of Dental Hygiene. But if you want to be the member, you can ask them, you can mail them, and they'll reply to your mail, inshallah. Be a fellow of the societies or the academies. As I've told you, you can be a fellow of Royal Society of Public Health. If you're inclined in public health, if you're interested in pursuing masters, pursue masters in public health, be a member, be a fellow of Royal Society of Public Health, or there are other societies also. There are other academies like Academy of Higher Education is there, Academy of Medical Education is there. You can become a fellow, you can be a member of these academies and societies. Now, what are the benefits of being a member or being a fellow? As I have told you before, there are lots of benefits associated if you are being a member or a fellow of any academy, any society, any college. Okay. First of all, you get to be associated with the experts in the field. many experts will find being a member or a fellow of that particular society or an academy. You will have many like-minded people or colleagues who are there with the common goals. You can collaborate with them. You can do something in collaboration, like you can do some research, or you can apply, you can have a discussion with them for pursuing masters or for PhD. There will be seniors also, there will be experts, there will be teachers in those societies, those academies, which can benefit you. You can subscribe their journals, newsletters also. Many societies, they come up with their journals, they have got their newsletters. So it's an advantage for you. Always it's an advantage for you, for anyone, to be a member of these societies or these academies. And you can also use the post-nominal letters. Say, as I had told you before, if you become a fellow of Academy of American Academy of Dental Hygiene, you can add those post-nominal letters in front of your names, FAA, DH, or FRSPH. If you become a fellow of Royal Society of Public Health, you can add those post-nominal letters also. But again, I'm telling you, there are certain criterias. It is not that easy. You need to fulfill those criterias. I'm not scaring you also. It's not that difficult. But these are the criterias you need to fulfill first. You need to see whether you are eligible for those criteria, you are fulfilling those criterias or not. After that, you can become a member or a fellow. So this is a good time for you to work on those criterias. If you are fulfilling partial criterias, if you're not meeting all the criterias, you can work at this time, you can work on fulfilling those other criterias. Now we come to $1 million question of our today's session. And what is that question? The question is, do I really need to keep myself updated? Do I need professional development continuously? And the answer is yes. There is a necessity to keep oneself updated. It has been rightly said by Toffler that the illiterate of the 21st century will not be those who cannot read and write, but those who cannot learn, unlearn, and relearn. Okay, it is important. Believe me, it is very important. I had learned something in my bachelor's, which I found obsolete in my master's. Okay, so there are things. Research is an ongoing process. The thing what is true today, it cannot be true tomorrow. So that is why you need to continuously update yourself. That is the reason one need to be continuously updated. Yesterday, I was discussing with one of my colleagues. We used to use formocresol for in the pulp. So that was a very common practice when we were in. It's a devitalizing agent. That was a very common practice when we were in bachelor's. But the moment we moved into our masters, we found out that this usage of formocresol is an obsolete thing. So how come we came to know about that? Through updating ourselves, through research. So research is an ongoing process. It never stops. And as I've told you, Toffler has rightly said it, that the illiterate of the 21st century will not be those who cannot read and write, but those who cannot learn and unlearn and relearn. So it is an age where whatever we have learned, if it is fine now, if it is it is fine. If you need to update something, you need to unlearn that, and then you need to relearn those things again. You need to relearn those skills again. Yes, history teaches us many things. Most importantly, the things that made us who and what we are. This was said by Robert Bonville, and it is very important. Okay, because of history, you come to know, and you try to incorporate those things. You try to avoid the mistakes which were done in the history. You don't try to do those things because of which it led to certain problems. You try to do the good things. Why? Because you want to be better. You want to be what you want to be. Get inspired. Okay, you have got a time now. You need to be inspired. Use your time wisely. Today, you all are confined because of this lockdown, and we must utilize this time productively. Okay, we have got the examples like Nelson Mandela, Mahatma Gandhi, Ibn Taymiyyah Rahimahullah, Sheikhul Islam, and many more. They all were confined. If you will read about them, they all were confined. Perhaps, definitely not for the same reason, for different reasons. Like, say, for example, Nelson Mandela, he was confined for 27 years. Mahatma Gandhi, he was confined for 6 years. Ibn Taymiyyah, rahimahullah, he was confined for 12 years in total. And what they have done, they have created history. They have changed the history. Okay. So this confinement, it should make you better. You must get inspired, and you must not get bogged down by this lockdown. Okay. You must not get bogged down by this lockdown. You must get inspired. Remember, this lockdown is temporary. It is just a lockdown, and it's not a shutdown. And only doors are locked, not our minds. Yes, the last thing is the storm will pass, inshallah, and you, I repeat, you will be the person what you desire, inshallah. Thank you.
Thank you, Dr. Mushir, for this wonderful and instructive presentation. It was entirely good and informative. I will share my screen now. Can I do this?
Yes, ma'am, go ahead.
Can you stop sharing yours? Okay, thank you. So does anyone have any kind of questions? I can't see any kind of question Q&A. I'll open them. No questions. Let me see the chat board. The only question that says, how can we get the links? You will find the links on the chat board, inshallah. Any more questions? I guess no more. Okay, we have one. Let me open this one. Here, one question that says, what's your recommendation or recommended university to get a master? Do you mean
Yes.
dental hygiene? Okay, can you have some response to this?
Yes, ma'am, yes. For masters, first you need to find out what master suits you. Okay, if you really want to do masters in dental hygiene, then those are the suggested universities. But again, I'm telling you, there can be other universities also. So first you need to find out all the universities which provide master's program in dental hygiene. You have to go thoroughly to the curriculum of each and every university. You need to really do a good research for that. After that, you need to discuss about, you shortlist some universities. Definitely you will not be able to fulfill the criteria of like some universities. Some universities the fees will be high, some universities it will not be feasible for you. They ask for some criteria which you may fulfill, which you may not fulfill. After shortlisting those universities, try to have the study plan or the curriculum of that master's program. Then you discuss those master's program with your, as I had mentioned in my lecture also, you discuss those master's program with the colleagues, with your teachers, with the seniors, with the ones who have already done that master's program. When like I was planning to pursue my master's program, I was in touch with some of the seniors who were already pursuing those master's program, and I was also in touch with one alumni, one pass out student from that from that university. So when you come in contact with them, you come to know the clear insights, you come to know the clear picture about the master's program. Sometimes it is good on paper, it's goody goody, okay, but it is not always the same. It is not always, the picture is not always bright. So you need to find out, you need to write down the pros and cons, and then after that you can go ahead with those master's program. And again, I'm telling you, there are other career options also. I mean, there are other master's program also where like dental hygienist can enroll. This was one of the misconception which I found I must say the most common misconception found in the dental hygiene students. Most of the students, my students, they approach me and they ask me what are the different master's program which we can pursue, which we can enroll for. As I had told you before, you can enroll for master's program. The first one is dental hygiene. There are other master's program also, like public health or dental public health, forensic dentistry, dental materials, infection control. These are all different master's program which a dental hygienist also can enroll. In my links, if you will go through them, my lecture slides, you will find the links to some of the master's programs. Is it possible to study dentistry after finishing dental hygiene or continue direct masters? There is no need for you to study dentistry. Immediately after dental hygiene, you can go for pursuing masters. There is no need. There are in some cases, see, we must know the roles and responsibilities of dentists is different than the roles and responsibilities of a dental hygienist. Okay. If you want to be a dentist, you have to enroll again for a bachelor's program in dentistry. But if you want to do masters in dental hygiene, there are many master's program available in dental hygiene. You can go for that.
Can I add one point, Dr. Mushir?
Yes, ma'am. Yes.
Okay. Regarding studying abroad or studying a master program, there are some tips that I would like to recommend everyone or remind everyone about it. First of all, to be full-time, to be recognized by the Saudi Ministry of Higher Education. Second point, which I strongly suggest, to have terms like oral or dental in your master program to be considered as an extension for dental hygiene specialty and to be recognized later on by Saudi Commission for Health Specialists. This is what I just needed to update everyone
yes,
with.
These are very valid and very important suggestions.
Yes.
One must really look for the criteria. Every country, or I must say the council, like here we have got Saudi Commission for Health Specialities. In UK, you have got General Dental Council. In my country, we have got the Dental Council of India. So every council has got recognized master's program. You must first look for whether the master's program you're planning to pursue is a recognized program or not. If it is not a recognized program, don't go for that.
Yes. One more question by Amal Al-Taibi. Does the University of Qassim has those master courses?
University of Qassim, as of now, we don't have a master's program in dental hygiene. But inshallah, in the future, we are planning to come up something called as postgraduate diploma. So this PG diploma, it will be a 1-year program. Again, like it is just out of discussion. I'm a member of study plan committee, so that's why I'm discussing these things. These things had come up in the meeting about opening up a postgraduate diploma in dental hygiene. So what this postgraduate diploma in dental hygiene program would be like, it would be more of the expanded function dental hygienist. A dental hygiene now has got some limitations. So say for example, a dental hygienist cannot do simple fillings or simple extractions. So we would like to add 1 more year where the student can pursue this postgraduate diploma, and after completion of this PG diploma, he will be able to do simple extractions and simple fillings, inshallah. This is the plan what we have got in the future.
Okay, can we do master in dental hygiene after BDS? Is it
masters in dental hygiene? See, again, I'm telling you, dental hygiene, during bachelor's, you need to learn lots of instrumentation. Believe me, you need to learn lots of periodontal instrumentation. The extent to which we are teaching our students here in Qassim University is beyond imagination. Okay, but those instruments, I must admit that I have never seen those instruments in my life during my bachelor's in dental surgery. Those instruments I came to know when I started teaching dental hygiene. Okay, We have got, of course, we have got periodontists also. Periodontists, they are aware about those instruments. But me as a public health dentist or as a general dentist, I wasn't aware about those instruments. So at a bachelor's level, after BDS, I don't think those bachelors are aware about those extensive instruments. And if you have got, I personally feel after BDS, you have got so many field to pursue masters, almost like you have got 10 or 11 specialities in which you can pursue masters. So why you want to pursue masters in dental hygiene? Leave it for dental hygienists to pursue, I feel.
Okay. Thank you so much, Dr. Mushir. I think no more questions that related to our lecture today. So on behalf of Saudi Dental Hygiene Society, I would like to recognize your valuable cooperation and efforts. And thank you so much, Dr. Mushir, for accepting our invitation.
Thank you so much, ma'am.
So
I would like to extend my...
Yes, okay.
Yes. Do we have some more questions or?
I think no more questions in Q&A. No more questions that related to, I mean, the topic.
In the end, I would also like to extend my gratitude to Saudi Dental Hygiene Society, DS Nada Al Sufyan, who's the coordinator, who's the moderator for today's program, my colleagues at Qassim University, and last but not the least, all the participants. It was indeed a pleasure. Thank you so much, ma'am.
Thank you so much. Please accept our certificate of appreciation. And not to forget our technical support body who made this activity reachable. Thank you, Tamer and Algidium companies for their cooperation and support. And please, again, accept our certificate of appreciation for Mr. Al-Hassan. Thank you, everyone, for attending our lecture today and for your time. And inshallah, we'll meet again in another webinar or scientific activity. Please, we are looking for your feedback, and please take some minutes to evaluate today's session and to fill your name, and not to forget to fill your name and Saudi Commission for Health Specialist. And for those who are asking about how to get their CME hours, these SDHS are the responsible institution who can submit your name and your Saudi Commission for Health Specialist number. Thank you again for everyone, and see you inshallah in another sessions. There are one more question, Dr. Mushir. Can you
yes,
see
ma'am.
it?
Yeah, fine.
So it's up to you. It's either you can answer it verbally now, or you can type type the answer. What do you prefer?
No, I prefer verbally. Okay, because.
Okay. So one more question. Do you think the master degree will help in clinical part?
Definitely, it will help in clinical part. If you're pursuing, especially if you're pursuing masters in dental hygiene, definitely it will hone your skills. Okay, but again, it depends on the university's program. We had one teaching assistant in our university, and he was planning to pursue his master. I think so. He had already done his master's program from one of the universities in United States, and he wanted to go for. He already went to pursue his PhD now. When we went through his transcripts, when we went through his program, correct, I don't remember the name of the university in United States, but the program did not offer much of the clinical hands-on. So he had more of a theoretical master's program than the clinical master's program. So if you really want to have like clinical good clinical master's program, enroll for the program which offers you good clinical practice. That will be helpful for you in the clinics, inshallah.
Okay, absolutely, yes. Thank you again, Dr. Mushir. I think there's no more questions. Let me see the chat. No, there's no more questions. Thank you, Doctor, for your time.
Thank
and
you,
see
ma'am.
you again, inshallah, or anyone of Qassim University teaching staff. Inshallah, we will have a meeting one day. Thank you so much.